Welcome to Disability Clinic, where we don't look as old as we feel. I'm Dr. Van, nice to meet you. Today we're going to talk about the disability that affects all of us if we're lucky enough: old age. If some of your loved ones are getting older, you're going to want to watch this video. I'm going to show you pictures of my grandparents because I'm extremely proud to be related to them and I want to honor their legacy. I hope that sharing my family's experiences can help other families out there who are also caring for their aging loved ones and encountering similar challenges. I come from a family of Vietnamese immigrants. My grandparents left Vietnam in the 1970s to escape a horrible war. As refugees, they immigrated to the US and got thrown into a totally different language, culture, environment. So my grandparents have lived through more trauma and hardship than I could ever imagine. And now that they're older, they want what every Viet elder wants: to live until age 100 in their own house that's full of family photos, pho, and Paris by night. And then one day they want to pass away peacefully in their sleep without getting rushed to a hospital. When I spend time with my elders, I appreciate how gracefully they've aged, and I can't help but think that's what I'm going to look like in 50 years, if I'm lucky. If you have aging loved ones in your life, I know the thought of taking care of your aging parents or grandparents or loved ones scares the shit out of you. But what you do have going for you is that you're here, you care, and you want to do right by them. So let's learn about this together. Here are the top 7 things you can do to take care of your elders before they become your ancestors. Number 1, keep in touch. There's texts, there's email, there's phone calls, there's even cards and letters in the mail. I know I don't have to say too much about this, but keeping in touch shows you care. Your elders may have lost many friends already along the way, and they might feel quite lonely and isolated without familiar company. You can help maintain that friendship, that connection with them, so they feel involved and engaged with what's happening in the family. Number 2, assess mobility. Mobility is how someone moves, and as our loved ones age, we want to help them stay as active and as safe as possible. How much ease do your grandparents move around with? If they're walking, can they keep up with you, which is a good sign, or are they taking slower, smaller steps? An easy, reliable test of mobility is called the timed up and go test, or TUG test. It's not what it sounds like. It's basically the amount of time it takes for someone to rise from a chair, walk 4 steps, turn right back around, and sit down. The faster you can do it, the more mobility, agility you have. An even more challenging test is to see how long it takes someone to get up off the floor. But if you don't want to subject your grandparents to these mobility tests, all you have to do is see if they're walking, how quickly are they moving. You can see how balanced someone is, if they're very wobbly, if they might benefit from an assistive device like a cane or a walker to help with stability. Or if they're not walking, maybe they're already rolling like on a scooter or a wheelchair. Does their equipment need optimization? Does it need repairs? Could it be more comfortable? Mobility is so high on this list because the most important concern as we age is losing mobility. Decreased mobility puts us at higher risk for falls. And the main thing you want to avoid in an aging loved one is a fall. A fall could mean head trauma, a broken hip, an injured spine. A lot of bad things can happen when you fall. Any sudden injuries after a fall can mean getting rushed to a hospital, needing urgent surgery, and experiencing more morbidity and suffering than anyone would want for their aging loved one. It happens, but let's try to prevent it from happening. So I highly suggest you get your loved one's mobility assessed by a doctor and a physical therapist. You might consider more equipment assistance and supervision at home to decrease fall risk also. Simple home accommodations that can help people with mobility needs include one-level living, grab bars, shower chairs, roll-in showers instead of tubs, and using Hoyer lifts. Number 3, track communication and cognitive function. Our minds don't necessarily age at the same rate as our bodies. Even if someone's mobility isn't what it used to be due to arthritis, fatigue, decreased endurance, often their mind can still be sharp and they probably still want to communicate and stay engaged with the goings-ons, even if they can't get outs. In terms of communication, my mom's mom is quite deaf. She does have hearing aids, but they're not always convenient. They're tiny, they're hard to put on, they're expensive to replace, and they don't work perfectly. So most of the time, she doesn't use them. Her TV is always cranked up all the way, and it's impossible to talk to her on the phone. So I text her every day instead. Can you hear better?
Yeah. No, yeah. If I do not put it on, I do not hear you well.
Has it been hard having to use the hearing aids? So that's communication. Now let's talk about cognition. My mom's mom is really still quite sharp. But a few years ago, we went on one of our infamous museum dates because we love going to see museums. And afterwards, I metroed back home because that's how I got there. And she had driven there. But What I didn't know until later that evening is she forgot where she parked and was wandering around the parking garage for 2 hours before some sweet person drove her around the parking garage floor by floor so she could find her car. After that, the whole family kind of decided with her that maybe it's not a good idea to drive to new places by herself. Ever since then, it's been a gradual decline. Nothing scary, thankfully, but now she doesn't drive on her own. And that's normal. And sometimes cognitive changes can be pretty abrupt, like if a big injury happens, like a stroke or a fall and trauma to the head. The brain is very precious, and the older we get, the more vulnerable we are when it gets damaged. Aging loved ones need to still understand basic things to get by. So checking if they know what month and year it is, understanding how to turn on the TV, using the microwave or the stove. These daily basics sound simple, but they can become really complex for an aging loved one dealing with dementia. My dad's mom played multiple instruments, sang songs in Vietnamese and in English and in French. Used to be a French teacher. She also tended a large vegetable garden, cooked delicious restaurant-level Vietnamese dishes, sewed intricate formal Vietnamese garments, or áo dài, and made stunning flower arrangements. Raised 6 kids. Just amazing. Anyway, she was told by a doctor several years ago she has diabetes. And she decided not to seek treatment for this because she didn't want to take medication. She didn't want to prick her fingers. That's just not what she was interested in doing, which our family respects. Everyone of sound mind has the right to declare what their wishes would be for their medical management, treatment of their health conditions or lack thereof. It's important to figure out and communicate what your medical wishes would be for yourself, what decisions you might make, so that just in case you can't communicate these, your family knows what to do and they don't have to guess. You can even turn these statements or wishes into official documents called an advance directive. This specifies what medical care you prefer, and your family can always go to that and say, this is what my loved one wanted. Instead of your family guessing, tell them yourself and fill out an advance directive, which can vary slightly by state and are linked in the description. These are good for the whole family, not just our aging loved ones. So, my dad's mom gradually developed dementia in her older age, and I was away from home for a few years, earning my credentials and becoming a doctor and ignoring my family. And one day my dad's mom asked my dad who a girl was in a photo, and he had to remind her that it was me, her first granddaughter. It sucked to realize that even though her memory issues and dementia were gradual, they seemed so sudden to me because I hadn't been there to support her or remind her or keep up with her. Step one is keeping up. So if you're aware of your aging loved one's communication and cognition needs, you can help accommodate them so they still feel involved, they can communicate and connect with you, and they feel comfortable in family and other social settings. Number 4, hygiene and self-care. It's the natural progression of aging for us to need more and more help with things that we used to be able to do on our own. Gradually, my dad's parents have been needing more and more help. It happens. Most people are happy to help their loved ones with basics like teeth brushing and getting dressed, but there are some less glamorous parts of caregiving that we should talk about. Let's talk about incontinence. Incontinence means peeing or pooping without realizing it or without communicating to someone you need help. Peeing, pooping, accidents, toilet, bathroom, commode, incontinence. In healthcare, sometimes we're too comfortable talking about gross stuff, and we forget how uncomfortable it can be for most people. But at some point, everybody's going to need help with cleaning, bathing, wiping, changing diapers, the whole shebang. So it's okay to be comfortable with this kind of stuff. When an aging loved one needs a lot of assistance because of incontinence, this is a pretty common trigger to send them to a nursing home, where ideally, healthcare professionals can provide the intensive hands-on care that someone needs. Whether your loved ones are being supported at home or being cared for in a nursing facility, nobody should be laying in their own waste for prolonged periods of time. It's important to get support from family members and also healthcare professionals like nurses, medical assistants, physical and occupational therapists, and doctors, because this is kind of a team sport at this point. It takes a whole team to teach and learn about maintaining continence, keeping your aging loved ones clean and dry, protecting their skin, protecting their health, and taking out the body's trash safely, effectively, and regularly. If someone isn't keeping clean, dry, and mobile, they're sitting on the same skin for more than a few hours, that skin is at risk for a pressure injury or a bed sore that could get infected and cause a serious illness. We do not want this. This is not good. Number 5, nutrition. At a certain point, it feels kind of inhumane to prevent someone who's in the twilight of their life from the foods that they enjoy. But here's some general guidelines so that you can support eating safely in older age. If you have diabetes, maintain even normal blood sugar levels and stay active. If you have kidney disease, stay hydrated and avoid a ton of potassium and medications that can hurt the kidneys. If you have heart disease, avoid salt and red meat and stay active. Softer foods are easier to chew and digest for someone who's missing teeth or has difficulty swallowing. Extra fiber, like prune juice or supplements like Miralax, can help prevent constipation. But it's important to find the right amount and frequency for these things so that you're not swinging wildly between extreme diarrhea and extreme constipation. Shakes like Ensure, Glucerna, or Boost, along with multivitamins and high-protein foods, are all easy strategies to boost nutrition in older age. As we get older, even if we want to eat, and we need to eat, sometimes we can't eat, either because we physically can't bring food to our mouths or we forget how. This can happen in advanced dementia. Many older people need assistance with feeding. My first experience helping a loved one with eating was with my great-grandmother, my mother's grandmother. If you're helping someone eat, make sure they've been evaluated by a speech and swallow therapist who can advise you on safe textures for foods and liquids, making sure your loved one is properly upright, like 90 degrees, while eating, and staying upright at least 30 minutes after the meal. There's also safe rates of feeding, so not too fast, so food doesn't get quickly inhaled or aspirated accidentally. That can put food into the lungs, which can cause a pneumonia, which is a bad infection. We do not want this. Preventable. Number 6, ask for help. You're already here, you're already watching this video, you already care. You're doing all the right things by educating yourself, being an attentive family member, and doing all these other steps. You are helping your aging loved ones age with dignity. But you shouldn't feel like you have to do it all by yourself. There are healthcare services dedicated to connecting aging loved ones and their families with support, education, therapies, home health assistance, or long-term nursing facilities if needed. One of the major jobs of the healthcare system is support people throughout this journey. So the hope is that you spend less time worrying about taking care of your aging loved ones, and you get to spend more quality time with your aging loved ones, keeping up, hanging out. You want to laugh with them, you want to reminisce about their favorite memories, and benefit from the wisdom that they share. Number 7, prepare for the end. Older people face significant morbidity and mortality. I'll just go over some common quick risk factors real quick so you know some major red flags to look out for in an aging loved one. If they're at risk for falling or they're falling a lot, if they smoke, if they have high cholesterol, high blood pressure, diabetes, cancer, anything that puts you at risk for a stroke or a heart attack, basically. If there are cognitive issues, if there's difficulty swallowing, incontinence, all of these things put people at risk for injury, illness, and accidents. When an aging loved one needs maximum support and their condition is unlikely to be reversible, the level of service for this stage is called palliative care or hospice care. It's best to think about this early on since these services provide generous support and resources, which take a lot of stress and strain out of the process. The focus of palliative medicine is not to heroically prolong life or reverse the natural process of aging. Instead, the focus is on comfort, safety, and quality of life, something we all want for our aging loved ones. Everybody dies. Some professionals in the business call this the resting phase of our lives, which is a delicate, gentle euphemism for death. Whatever terminology you prefer is what you should use, but you should talk about it. The best way to prepare for your loved one passing away is to not avoid it and accept that it will happen one day. But of course, up until that time, you want to keep your loved one safe, comfortable, and happy for as long as possible. That's all we can do. And that's enough. Oh, I'm getting cheesy. Part of any family's legacy is teaching the next generation what it means to take care of their aging loved ones. Yes, it is sad when a loved one passes away, but one of the positive things that comes along with death is that family and friends can gather and celebrate that person and the lasting impact they will have for generations to come. Whew, okay. That video got pretty heavy. I wanted to honor my grandparents, show off how proud I am of my family, and hopefully help other families who are going through the exact same thing, but maybe don't know where to start. If you have any questions or reflections or want to share your own story or some feedback, please put it all in the comment section below. If you appreciated the reminder to text your aging loved one, give this video a like and subscribe to this Ability Clinic for more accessible, educational, and entertaining content. We're trying. Until next time, thank you for watching, listening, and learning. Okay, I love you, but why?
I love you too, cục cưng.
I'll talk to you later.
Yeah, talk to you later.
Okay, bye bye.
Bye bye.